Patients ask me about keloid formation with eyelid surgery, nasal surgery, chin implants, facelifts, otoplasty. It's very, very rare, and I've never actually seen it in eyelid surgery or rhinoplasty or something along those lines. I have seen some hypertrophic scars on the face that needed to be treated with fat transfer, PRP, and surgical excision. And that's all fairly straightforward. Where you do see keloids form on the face is around the ears, either with facelift incisions, otoplasty, or piercings. The way I prefer to treat those is, if necessary, I'll pre-treat the area with PRP and fat transfer, followed by surgical excision of the keloid and closure in multiple layers so that there is long-term strength of the wound when it is healing. For just another note about scar tissue on the face, or like a large scar for, say, some injury or something along those lines, repeat steroid injections for a scar tissue like that is not always in your best interest, because it can thin out the tissue, thin out the fat, thin out the skin around the scar, and actually make the scar look more depressed. A lot of times it's better to maybe do 1 or 2 steroid injections, if at all, to treat itching, redness, hardness, followed by an actual excision of the scar tissue, or fat transfer and PRP treatment of the scar tissue itself before any other surgical intervention. So if it's being recommended to you that you have many injections or multiple injections of steroids for a scar on your face, you might want to get a second opinion or a third opinion to make sure everybody agrees that that would be the best plan for you, because sometimes it just thins the tissue out and makes the area too weak and creates a depressed scar, whereas before you had a raised scar. But for keloids around the ears, it's a surgical excision, and there's also never a guarantee that it's going to work out great for you, but a lot of times it does if it's done properly and done with the appropriate steps before surgery.